here, and I'm talking to Martin Laverty, who is from the Royal Flying Doctor Service, the CEO. You've just been in the prevention session at the ALP National Health Policy Summit. What were your takeaways from that?
Well, the main theme was that social inequality is the main cause of ill health in this country. The disparities in health outcomes that exist for people who live in remote Australia, who live in low socioeconomic communities, needs action through the social determinants of health. The room discussed that in 2013 there was a tripartite agreement between the Liberal Party, the Labor Party and the Greens to implement the World Health Organisation Action Plan on Social Determinants of Health. But 3 years on, that report still sits on the shelf. I think it's relevant to remember that the Canadian Medical Association said just before Christmas that the greatest improvement that needed to be made to improve the health of Canadians was action on poverty. Well, that room, I think, agreed that action on socio-economic factors that cause ill health is essential to ensure we have a sufficiently working preventive health system in Australia. I'm concerned on behalf of the Royal Flying Doctor Service that health prevention in remote Australia appears to have failed, not through effort of many and not through good intentions, but we see chronic illness, avoidable illnesses, at 3 times the prevalence rate in remote Australia. That says to us that our health prevention system is not working as it should. We need investment, we need better access to primary care, but most importantly we need partnerships across those who work in remote Australia to improve the health outcomes of both First Australians and those who live in country areas.
And what will we need to get that happening under a Labor agenda, and also pushing it with the coalition now? How would you measure a really good start and a really good roadmap?
Well, I made the point to the prevention discussion this morning that the Remote Australia Health Strategy expired in 2013, so that at the moment people who live in remote Australia, there isn't actually an overarching policy to address health prevention consistently across the nation. And that's why we see some pockets of good health outcomes in remote areas and others that need improvement. So the one message that I think the room provided today is that there should be an update of that 2013 health prevention strategy so that all people, no matter where they live in this country, can enjoy good health.
And just a quick one, the Rural Health Commissioner, any word on when that's happening and who it might be?
The legislation has been introduced into the Parliament. We expect that to be subject to the scrutiny of the legislative review in the next little while. But we're very pleased to see that the government has delivered on its commitment to establish a Rural Health Commissioner. It's going to have its first focus on improving the pathways for general practice to work in country areas. We think there's a whole lot of other issues, such as overcoming disparities in access to healthcare and disparities in healthcare outcomes, that should also be the mandate of that Health Commissioner. I had the opportunity to outline that case to the National Press Club with colleagues from the rural health sector before Christmas time. I'm very hopeful that as the legislation is considered about the Rural Health Commissioner, some of those agenda items will be picked up.
Fantastic. The next session's beginning. I better let you go.
Thanks for having me.
Thank you so much.
Pleasure.